I'm Dr. Viral Desai. I'm practicing for the last 25 years. I'm a plastic surgeon from Mumbai, India. Graduated from Sir JJ Group of Hospitals. And yes, I've been using exosomes for around 5.5 years now. Actually, they were introduced to me in IMCA's annual congress. I heard a lecture about exosomes. I saw a booth there. And then a couple of my friends who were actually talking about it and using it from Korea and from Taiwan. So they are the ones who introduced me to this, and it got me excited. Of course, we knew about exosomes to be. I mean, we used to consider them to be a waste product and for drug delivery and for cancer research. But the aesthetic part of it, I was introduced around 5.5 years back. Well, I'm glad to say that I was the pioneer to use exosomes in India. So we started around 5.5 years back, and just great results. Great results. No, I think it's been there for some time now. And ExoCoBio, of course, one of the pioneers to actually start this, has been there for maybe a decade. So there is good amount of literature now. There is enough publications. Every year we are seeing more and more publications. So this is something what PRP was maybe 25, 30 years back. But today it has grown and we have a lot of data. So we know that exosomes is here to stay. It's just not a trend. It is going to be here, but we still have to explore a lot of sides of exosome. Well, exosomes have been there for some time. We used to consider it to be a waste product, and now we know that it has so much more therapeutic benefits. But yes, for aesthetic use, it's been there for around a decade. And ExoCoBio, of course, has been one of the pioneers and leaders in this field. We know that it works now. I have been using it for more than 5 years, and we're very happy with the results. I don't think it's a trend. It's what PRP was maybe 25, 30 years back. So we have still a lot of unanswered questions, a lot of more data, a lot of more research, safety factors, precautions to still see delivery methods, lot of regulations of different countries that have to be followed. But it's not a trend. It's here to stay, I believe. I had a patient who's on follow up with me for around 10 years plus. He's a mixed case of areata with androgenic alopecia. He responded to traditional therapy earlier, initially, and he's been coming to me for last 5 years. We've been trying everything from oral dutasteride, injectable dutasteride, minoxidil, everything, PRP, PRF, IPRP, everything possible. Okay. Finally, we got exosomes and we tried that on him. This was around 4 years back, and he responded beautifully. It's been 4 years. He's very well controlled. He's actually one of my patients who put my faith into exosomes. So yes, I think that's one case I can think of, because for 3 years we were initially responded, and then for 3 years, every time he came, we tried something new. He just wasn't responding to any kind of therapy. So for me, I have been mainly using a lot of exosomes for hair. That is my forte. Some for skin, but mainly for hair. So not only any kind of androgenic alopecia, male pattern or female pattern or patterned hair loss, definitely. Besides that, autoimmune, even scarring alopecia. So another patient, a failed hair transplant, post biofiber implants. Biofibers got infected. They left behind a lot of scars. He had a failed hair transplant. We injected exosomes. We made the scars better. The scars became healthier. The bleeding improved, the texture of the scars, quality of the scars, and we implanted, and he's got fantastic results with nearly 90% take. So that's another case I would say. Exosomes has worked miracles. Well, see, first, the purity matters, okay? Where the source is, what is the purity, how is it isolated, is it just conditioned media, or is it pure exosomes? How are they stored? How are they transported to your clinic? Because they're very, very temperature sensitive. If it's a lyophilized powders, that's the best way to store them, right? The other thing, in India at least, you need to know the source, because as of today, regulations, you can only use plant-based or autologous. You're not allowed to use animal or human products. So that's another thing. Plus, of course, the number of publications, the manufacturing facilities, sterility maintained, how many people globally, the KOLs using it. So all these factors put your faith in a particular product which you're using. Like I said, when I started using around 5.5 years back, the first thing I tried was in my 5 regular patients who were in regular follow up with me, maintaining with medical therapy. They improved further. So that put my faith in exosomes. After that, I kept on using it for more and more patients, right? Now, today, how I pitch it, I say if we had, everybody knows PRP, everybody comes asking for PRP, and now exosomes have become common, but at one point, so I would say if PRP has growth factors, I'm offering you something, growth factors which stimulate the stem cells. I'm offering you something which goes within the cell and stimulates it right from within the inner mechanism. So it works far, it's more potent and it works much, much better. So, I mean, when I say that, most of the patients are convinced and they go for exosomes. To a large extent, yes, because maintenance used to be difficult. How we used to maintain used to be very difficult. With the advent of exosomes, become quite simple. We do standard 3 to 5 sessions protocol, followed by every 3 months or 4 months they do a maintenance, and they all maintain quite well. In most of the cases, we are able to taper off the minoxidil and finasteride also, so it works very well. And patients are very happy about stopping finasteride, especially. See, of course, minoxidil and finasteride are still the gold standards in the terms they're the only FDA-approved treatments today, right? Finasteride is anti-DHT. It has its own problems. Half of the people don't respond to it. Not half, but I would say at least 40%. That's what literature says. But main thing is the post-finasteride syndrome, the immediate and the late problems, and a lot of negative part on internet. That's why a lot of patients will stop finasteride even if they start it, even if you counsel them. Minoxidil, we know that it requires a high dose, it requires sulfonyl transferase to get transfer to minoxidil sulfate, and all other problems with minoxidil makes the hair unmanageable. So yes, the compliance is very, very poor. Plus 40-50% do not respond well enough. Now, hair being a tight compartmentalized organ, it's a very small and a tight compartmentalized. So it requires tiny factors, soluble factors, which can actually move from compartment to compartment. And of course, exosomes being the smallest, less than 200 nanometers. So it's easy for them to move from hair follicle to hair follicle. So the delivery becomes easy to do. So that's where it comes. Plus the rose stem exosome that we use, as of today, there are 31 identified microRNAs which are similar to what are found in the DP cells. So yes, I mean there's so much of literature and science to it, and simply because of hair being a tiny organ, you need something small to be soluble there, and exosomes fit in very well. So whenever I give my talk on exosomes, and we put it under regenerative, right? The ultimate regenerative medicine. People ask me, can I do with PRP? Can I do with this? Can I do with that? I said there is no contraindication to use exosome with any other therapy that you find beneficial, because it does not interfere or it does not decrease or increase the potency of any other therapy. So whatever the kind of alopecia, whether it's immunogenic, it's scarring, non-scarring, exosomes will work. They definitely show benefit. Yes, the results are much better in patterned hair loss. Early stages of autoimmune, yes, it does work. But even if there are scars, it actually improves the quality of the scars significantly. So that's another big benefit. Well, aesthetic is a very glamorous field. So we all talk about regenerative medicine and exosomes or so many more things in aesthetic. But I think exosomes have a very big role to play in burns, burn healing, chronic non-healing ulcer, diabetic foot, diabetic non-healing ulcers, venous ulcers, traumatic wounds, and so many more. So also exosomes are delivery mechanisms for drugs. So you can really have a fabulous result for cancer. Well, I'm going a little off aesthetics, but I think this is the future. We know that exosomes are going to be here. We probably will be using a lot of more topical solutions, home based, like shampoos and conditioners, topical creams, anti-aging. You probably find exosomes in sunscreens and in everything possible, wherever the body needs reparative or regeneration. Okay. But I think the future there'll be a lot of exosome research for cancer and for healing. So I think that's the future. So instead of coming to the clinic and having big doses of exosome delivered at periodic intervals, You'll have patients who are using it topically at home and having small doses daily. So I think that is the future, and that's what we're going to be looking at. So exosomes are probably going to be on over the counter, and we already see some products there, and I'm sure there's going to be a boom in these kind of things over the counter. When we talk about disease transmission, especially when it comes to human or animal, or the potential carcinogenic risk, I think that's more exaggerated because you're talking about the microRNAs, the small channels. So probably yes, but we should have some more data on this for the future to extensively use exosomes henceforth. Also, the delivery mechanism. Okay, if you are microneedling it, why not inject it? So maybe that's the future. Something where we will waste less product, we'll deliver it deeper, we'll deliver it more closer to the target, or target mechanism. So yeah, we need to see these things in the future. Well, thank you so much, and it's a pleasure being here. Pleasure to be here in the Regenerative Aesthetic Medicine Conference by ExoCoBio, and I'm really looking forward to the wonderful day that we have ahead. Lot of talks, lot of interesting talks, speakers, and case presentations. Thank you so much.